Mike Sturla. I chair the Democratic Policy Committee in the Pennsylvania House of Representatives, and today I'll be joined by Jim Bowder, Catherine Hughes, Kim Schenk, some lawmakers, and countless friends to address a change in public policy at the Welfare Department affecting hundreds of families with disabled children and also their service providers, as well as, ultimately, I believe, taxpayers in the state of Pennsylvania. I'll provide a general overview of the harsh new policy and how it seems to have appeared overnight. Mr. Bowder, a parent who will be affected by the new DPW policy, as well as an advocate for other parents, will provide some details of who's affected and what services are included. Ms. Hughes and Ms. Schenk, both parents with disabled children, will provide their perspectives on how their families will meet with this new budgeting challenge. The Department of Public Welfare, under the direction of Secretary Gary Alexander, quietly announced in August's Pennsylvania Bulletin an unwarranted change to the policy that will cost Pennsylvania families millions of dollars and force them to make tough decisions about whether to pay for essential services for their children or purchase basic necessities. The new policy will levy copays for services provided to those with disabled children, including those who are autistic or have physical disabilities. Some children receive several services a week. These plans should be implemented in November under the announcement and will bypass the formal state review process. I want to emphasize that the quote-unquote savings are less than the projected cost of implementing the program and future costs involved with those people affected. So the policy here is looking at spending more to make a policy less efficient, adding cost to parents, negatively impacting the lives of children with disabilities. If you ever wanted to prove that government didn't work, this would be how you'd go about it. You'll hear from parents who've gotten letters that incorrectly identify their incomes. So now we'll have parents who are trying to spend time helping their disabled children, trying to prove to the government that they don't make as much as they do so that they can get services for their children. And we've just added another layer of bureaucracy when the cost savings to the state, as I pointed out earlier, were actually minuscule, and in the long run it will actually be more costly. In 2011, Secretary Alexander was tasked by the GOP to find over $400 million in cost savings at DPW. A task that even he admitted during the Senate confirmation hearings would not be attainable. And I believe yesterday the Secretary said he wasn't sure that this policy actually made much sense, but they were going to try it anyway. Later in 2011, Governor Corbett signed Act 22 into law, which granted DPW immense latitude in making changes without the usual oversight, which is precisely what's happening here. Simply a decree as to what was going to happen. The policy of collecting copays for the extensive range of services for children with disabilities will do three things. One, it excessively burdens Pennsylvania families with an additional cost. Parents will now be forced to choose between therapies for their children or their basic necessities. This is a burden that both the Hospital and Healthcare System Association of Pennsylvania and the Pennsylvania Health Law Project have expressed deep concerns with. Two, Secretary Alexander has moved past cutting fraud, waste, and abuse from the DPW budget, if any measurable amount was there to cut to begin with, and is now cutting hardworking, tax-paying families when they can least afford it. And three, and make no mistake, these cuts are unnecessary and will fail to create the savings, and it will cost hardworking Pennsylvania taxpayers. Here's how. It's unnecessary because existing autism insurance coverage under Act 62 of 2008, if fully implemented and enforced, would save DPW over $25 million a year, which would far exceed any savings created under this new policy. And Secretary Alexander's plan doesn't save the projected $5 million it claims. It fails to save that amount due to the medical assistance cost-sharing formula, under which Pennsylvania only sees 40 cents on every dollar saved. The remainder goes to the federal government. So in order to produce DPW's $5 million in savings, over $12.5 million in co-pays must be collected. That's $12.5 million from families with children with disabilities. This plan will fail all Pennsylvanians as miserably as it fails our families with disabled children and their service providers. If DPW would enforce current law, ill-advised plans like this wouldn't need to be considered, let alone implemented, without oversight. However, and I suspect Governor Corbett and all his deputies are beginning to realize this, Pennsylvania families will not allow changes like this to take effect quietly or under the radar. And now you'll hear from some of those parents who are speaking out loudly and forcefully.